presents and has good tone, has a spontaneous respirations with crying, and the color is improving, the baby typically would go skin to skin. If there's anything that we would question as to the extrauterine transition, we'll again typically we'll go skin to skin and we'll do some further investigation right there. And then, excuse me, assessing and intervening immediately following the delivery, things that we may be involved with or assist with would be perhaps fundal massage, encouraging that uterus to tone up, perineal inspection, inspecting the perineum for lacerations, tears, and episiotomy and repairs, making sure that everything is intact. Placental inspection, we may be involved with inspecting the placenta to make sure that there are no obvious fragments missing, and we would also be in charge of making sure that the placenta is disposed of or stored properly if it's going to be going someplace else. And then the collection of labs, so perhaps if we're doing cord blood that needs to go to the blood bank, those types of things will be labeling our specimens and sending them off. So just a few special considerations as we end this PowerPoint session. The cultural aspects of childbirth. Oftentimes there's many cultural rituals that go along with a family welcoming a baby into the world, and it's something that we'll cover more when we do our community and culture lecture in a couple of weeks. But it's certainly a very appropriate measure that we have to be aware of in nursing. Social aspects, socioeconomic. We could be caring for clients who don't have the financial capability to provide housing or food or safe transportation, the purchase of a car seat. So social aspects, maybe isolation. Maybe this mother is alone. She arrives unsupported or has no support person or family available. Perhaps there's domestic violence, or the birth is a result of a rape. So there's lots of social considerations that we have to keep in mind when we're caring for women who labor. And then obviously medical concerns, prior diagnoses, medical conditions that they've been living with, prior surgeries that may perhaps have limitation, progressive diseases that the client has been dealing with prior to this pregnancy and this delivery, even issues of things like obesity or anorexia. So all of those considerations are important when we're providing care to the normal, healthy, laboring mother. And then there's that last NCLEX check. We're always making sure that if I were to answer a question from management of care, maybe perhaps it might be discussing birth plans and the mother's determination of care. It might be basic care and comfort as it relates to the labor patient and pain management. It could be questions that relate to safety and infection control surrounding rupture of membranes, minimizing sterile vaginal exams. A question could be from the pharmacological parenteral therapies category about those 3 important drugs that we see used in labor and delivery: oxytocin, methogen, and Cervidil. Psychosocial integrity, forming a therapeutic relationship with the laboring family, being able to support them. They could be anxious, they're frightened, they're first-time parents, they've never done this before. Physiological adaptation. Do I or you know what's happening to the body as the woman labors? So looking at those reassuring signs that things are still normal, knowing what's a normal finding during labor, the reduction of risk, the ability for you, the novice nurse, to look at this laboring patient and identify what things place this patient at risk. What things are we doing to reduce that risk? So maybe it's looking at that fetal heart to make sure that the baby's tolerating labor. And then finally, health promotion. In which ways, could you answer a question, in which ways are we promoting wellness throughout the labor process? What kinds of teaching? So maybe childbirth ed comes in here, and that is helping the mother cope with her labor process. That is it. Have a great night.